Next, we're going to talk about some possible misconceptions that we have observed through our research, but then also at the same time, just some of the thoughts that people have overall about gender affirming voice therapy. So we have 6 overall, and our first misconception that we are going to talk about right now is that gender affirming voice therapy is a standalone service. According to ASHA, which is our governing body that gives us as speech therapists our licensure and our guidelines to provide the best quality therapy to our clients, they tell us that SLPs are made to be aware of other medical services that may be provided to the client. And we are told to make sure to coordinate with the provider. This is so that the best care is given to the client. And some other providers that could be a part of our team are ear, nose, and throat doctors, primary physicians, and counseling, among other professionals. Our second misconception is student-based clinics do not provide adequate care. So student-based clinic and services means better care for you. Students hold utmost respect and care for their clients as they are constantly developing their skills for providing the best care possible. Students also want to do their best, so they naturally are going to dive into the research and get the questions that are needed to be answered to be able to provide adequate care. Students also care a great deal about their clients, and students have the qualifications to provide the best quality therapy because they're supported by licensed staff members and they have the resources available to them to be able to plan the best care possible. Our third one is coming into speech therapy will fix someone and or give the desired outcome. We will make sure that your vocal health is important and at our utmost responsibility that we are going to be taking care of it. We will we will get you to a point that is as close to your authentic voice as possible without damaging your vocal tract, as we can identify the threshold for vocal health. Our fourth misconception is gender affirming voice therapy is only used to make one's voice more masculine or feminine. Therapy starts with a conversation to grasp an understanding of the client's target voice. The client's targeted voice does not need to follow what is considered to be a traditional feminine or masculine voice. From here, goals are made for the client to focus on in sessions, and therapy can be provided to focus on one's communication nonverbally, such as facial expression and eye contact. Our next misconception is one must know their targeted voice prior to starting therapy. The start of therapy is a time when we can come together and investigate and test your voice system. The main system we look at is your vocal folds, which are small flaps that sit above the tube that leads to your lungs, and these flaps come together or apart as you speak. Therapy is client-focused, so the speech therapist is there to provide support on the journey to finding the target voice that the client wants. Our last misconception is gender-affirming voice therapy has specific goals or plans. Therapy is a dynamic relationship. The goals that you start out with will change as you get closer to finding your authentic voice. For example, you may want to focus initially on tone, but this may change. Again, voice therapy is client-centered.